Welcome to Local Business Spotlight, everyone. I'm Troy Thompson. I'm over here with Dr. Christopher Lesar from Vascular-Institute of Chattanooga. Welcome to the show, my friend.
Thank you, Troy.
I want to find out, before we get going, where do we sit here in our county in regards to kidney and vascular issues?
Okay, so I'm a vascular surgeon and I take care of a lot of patients with vascular problems. Kidney problems are part of that. What we have is about 43% of the county has problems with hypertension, and half of those people are not controlled. They're out of control. We have about 25% of the county that still smokes. We have 25% of the county that still has very low activities. And so those are the things that can cause vascular problems. When we talk about kidney disease, one of the things that I do is create a shunt for patients who require dialysis. And dialysis is when your kidneys go on to fail. So about 15% of the county have chronic kidney disease. And as that progresses, then patients get to see me so that we can create a shunt so they can go on to dialysis.
So 15% of this county is on dialysis already, has
chronic kidney disease, and they're at risk of going on dialysis.
Well, let's talk about the wavelength and a better option for patients.
So as a surgeon, I'm responsible for making the shunt so that we can take blood from the patient, put it through the artificial kidney machine, dialysis, and put it back into the patient clean. And so you have to do that with 2 needles. And when we create that shunt, the patient can go on to dialysis at that point.
Okay.
Now that has always been historically surgical. I have to make an incision, and we do everything in surgery to actually put the 2 arteries and veins together. Nowadays, there's a newer technique called WaveLink, and that has been pioneered through part of our company here with the Bard company, and we can create the fistulas through 2 little needles, and through the needles we can put little wires that will connect together. We pass a little energy through those wires, and then that creates that fistula, which is so important for that dialysis patient.
Well, now you're saying it's a little bit easier. Should I say easier?
It's not necessarily technically easier for me, but it's much easier for the patient.
For the patient.
Yes.
So can this be done as an outpatient?
This is done as an outpatient currently. The procedures last about an hour to do, and we have a program that develops that fistula over the next 2 months to really get a patient ready for that access, so the nephrologists in town can actually take care of patients with dialysis needs.
I want to talk about the recovery time after this procedure, if I can.
Yeah, most people are very surprised how quick they feel better. It's all done through a needle, so there's no surgery, there's no major anesthesia associated, but patients get well fairly quickly, and by that 2nd week, they're back to see me with an ultrasound so we can check everything and make sure things are working right.
So what's the scarring? Do we see major scarring on the body?
No incisions.
Healing?
If there's no incisions, there's no scar.
This is the most amazing thing. What made you want to come up with this particular product?
Well, we're trying to be pioneers in the area to prevent limb amputation for people with severe swelling of the extremities, venous problems, venous blockages, and for people with our chronic kidney patients, we want to give them the best options available, and this is the latest technology that's available for our patients.
Can I ask you very quickly, Doctor, what's one of the things that you love about what you actually do?
I love the patients. I love the patients, and they love me back, and that's a great experience.
And that's what motivates you every day to come to the office, right?
Yeah.
It's the most rewarding thing that you can do. Thank you for everything that you do for our community as well.
Appreciate you, Troy.
If you want to find out more information, there it all is up on the screen for you. I've been chatting away with Dr. Christopher Lesar from Vascular-Institute of Chattanooga. Back after this short break.